Alrighty, well, this is our February 2026 meeting of the Community Health Advisory Council, or CHEC. We've made it through January. It was probably one of the longest months ever, so we can move on from that and welcome February. My name's Katie, and I get to serve as the CHEC chairperson. The Community Health Advisory Council is established in Oregon law and instituted locally here in Crook County. CHEC provides recommendations to the Crook County Board of Commissioners regarding public health and behavioral health. These meetings are an important opportunity for partners in the community to work collaboratively to support the health and safety of Crook County. Please note that this is a public meeting. However, there is no designated public comment period, and members of the public may not speak during agenda items. If you are a member of the media or general public and have questions or comments, we ask that you reach out directly to a CHEC member or staff member outside of this meeting. We'll begin today with a member roll call. When you're called, please share your name, role, and organization if applicable. And then after roll call, we'll invite staff members to introduce themselves. All right, Alex, are you able to help me with folks online? Okay, Emily.
No Emily.
Grant.
No Grant.
Courtney.
Courtney Peressa, community member and outpatient physical therapist at St. Charles in Brainville.
Welcome, Courtney. I'm Katie Plum, Health and Human Services Director. As I mentioned, I serve as chair and I'm present. I'm here and accounted for. Erica.
No.
Hope.
No.
April is on her way. Bill.
Nope.
Kimberly.
Yes, Kimberly Munn, Chief Nursing Officer at St. Charles.
Welcome. Liddell.
Oh, yes. Community member and I'm his mom.
We are on a roll. Audra.
No.
Tom.
He is here.
Yep. I'm Tom Evans. I'm the Crook County Veteran Service Officer.
Welcome, Tom. This is Tom's first meeting with us. Devin.
Yep. My name is Devin Nelson Harmon. I am with the National Alliance on Mental Illness Central Oregon chapter, program and community manager.
Welcome, Devin. We are, April, I think just popped on.
No, Angela.
Angela. Hi, Angela. Okay. We'll get to Angela intro in just a second. We are short quorum at this point, so we'll give it a little bit of time. If we have to do any, take any votes, we will wait or defer anything to our next meeting. So for now, let's do staff introductions in the room and then we'll have staff on the line. Introduce yourselves. Alex, do you want to go first?
Yes, hello, I'm Alex Greenberg. I'm a health programs coordinator for mental health, suicide prevention, tobacco prevention, and alcohol and other drug prevention and promotion.
You nailed it. Very good. Steph, you want to introduce yourself?
Hi, sorry, I thought it started at 11:30. I'm Stephanie O'Neill. I am the Public Health Modernization Manager. I supervise prevention, health promotion, and environmental health and public health emergency preparedness.
Crushed it. Shelby.
Hi, I'm Shelby Fisher, the Crook County Health and Human Services, and I work on the prevention team as well.
I'm gonna do a quick sound check. Mike and Kimberly, are you still? Angela, folks online here, okay? Okay. Riley.
Hi, everybody. I'm Riley Martin. I am with Crook County Health Department as well, and I work as a public health emergency preparedness and response coordinator, and also work a bit on the tobacco prevention and education program team.
Excellent. Mike.
Yeah, Mike Case. I'm the program manager for the community DD program in Crook County, employed by Best Care.
Good to see you, Mike. Angela.
Angela Cumming, I'm the program director for Best Care in Crook County.
Angela. Happy Monday. Haley.
Everyone. Sorry, my computer is being extra slow right now. My name's Haley Morris. I'm the overdose prevention coordinator for the Crook County Health Department.
Good to see you, Haley. All right, did we get everybody? I'm thinking so.
Rita was there, but she left, so I think we're good.
Okay, we might snag Rita. She comes in. Is this as loud as this will go? All right. Thank you again for everyone for being here. I mentioned earlier that we are scheduled for a 2-hour meeting. I do not believe this will take 2 hours. But we'll see. We could be extra chatty today. I don't know.
That doesn't work. Only,
Trying to my notes. I'm so organized today, I promise. I have all of the tabs open in one spot for us. I didn't even have to dig for my script. Okay. Tom, you're our only new member here today so we'll need some paperwork signed
I'll bring it by your office
by
tomorrow.
you that Alex will bring by. Excellent.
Sounds good. Thank you.
I do want to highlight in the meeting agenda and the meeting notes, there's some public meeting supports. So for appointed members, there's a link for the Oregon Governmental Ethics Commission. There's a lot of training and information about what we can and cannot do as appointed members to a public body. So I recommend checking that out. If you have questions, you can always ask Alex or myself. We're happy to support that process. Next on the agenda is member announcements. So for our appointed folks, does anybody have announcements you would like to share with the group? Either if you're online, you want to raise your hand, or folks in the room. All right. I imagine that we'll have time after later in the meeting if you think of something. Staff announcements. Let me go first, Alex.
Sure. So one thing we just wanted to update everyone on is one of the things that our prevention and promotion team does, which is most all of us here, is we have a club at the high school that used to be called SAD, which was Students Against Destructive Decisions, but the kids decided they didn't like that name anymore. So we changed it to SPARK, which is Students Promoting Awareness, Resilience, and Knowledge. And they did a clothing drive last fall to get clothes for people for the winter. So it was a warm clothes. I think they called it the Cozy Campaign. And they did a really good job. We had a total of like 10 or 11 boxes of clothes that got donated to the Holiday Partnership, the fan advocate groups at the middle school and high school. And I think we took some to Craig's Compassionate Cafe also. Yeah, or Redemption House, sorry. So it was really good and they did a great job.
How big is that group?
There's about 8 to 10 kids that show up on a regular basis. And then we also started doing it at Pioneer High School this year. It's a little bit different over there just because the kids aren't as eager to do the same type of stuff. So over there, it's more about education and trying to, talk to them about mental health and substance use prevention and stuff like that. But there's also a good probably 10 to 15 that show up regularly there to participate.
Cool.
Probably more like 12 on average.
We had pizza at the high school, we had like 30.
Yeah, I think there was 26 kids. Yeah, but they like food.
Yeah. And if I remember correctly, Spark at Pioneer meets right after the lunch hour.
Yeah.
So it's been a good engagement strategy for Pioneer period, because it gives some students some extra motivation and interest in coming back after lunch. So kudos to your team for doing that work. And if anyone would like to know more information, you can reach out to anyone on the prevention and health promotion team. They can help out with that. Perfect. Any other announcements from staff?
I've done this morning.
Okay, what have I said? What have we? Sorry.
I also learned recently about this, it's an online health program called Equipped Health, and it's specifically for people that have eating disorder issues. And it's all online, but they have doctors, therapists, like a whole team to go to. They take private insurance. I believe she said they also take OHP. And the only requirement is that you have to have a primary diagnosis of an eating disorder. But if you also have like a substance use disorder along with it, they'll also co-treat that as long as your primary diagnosis is for eating disorders. She's coming back to talk to us more in March to the whole health department. But if anyone else is interested in having her come meet with you guys, I can put you in contact with her. She has way more information than I do. So.
And it's a totally online.
And I think she also said if they don't have internet or Wi-Fi, they provide it. I did ask her if it only activates when they have appointments or if it's like all the time, and she did not know the answer to that yet, so she's gonna get back to me. But yeah, so they try to help make it as plausible as possible for people who don't have the ability to transport themselves or to get far distances to appointments. So yeah.
Steph, do you want to give a quick update on the modernization plan status? Because we haven't met since December.
Yeah.
December.
Sure. The modernization plan is complete and turned into OHA for approval. As you can imagine, those plans are really lengthy and they have every county to go through, so we haven't heard any feedback on it yet. I think that'll take a bit of time. But they did give a little update in a meeting the other day that said that everyone's is looking really good from what they've seen so far. So hopefully hopefully it won't be long until we get some feedback on it and then we can go from there, but I don't foresee it missing any elements. There was a checklist that we had to go through to make sure that everything that was required was on it. So I don't foresee that happening. Usually OHA has tweaks or like some sort of like good feedback for us, so I'll share that when we hear about it.
I would love to say, and maybe Angela can share this with the behavioral health side of OHA. I think it could be a good lesson learned is we did a lot of legwork to make sure that all of the counties that needed to submit a plan, all of the entities were well aware of what OHA was expecting of us. We created tip sheets and templates and things to make it easier for us to complete the required portions, and also for the reviewers at OHA to be able to make quicker work, because it is a lot to dig through. These plans are massive. I know the plan that Angela put together was huge. And so it's really helpful when those are across the state in similar formats for our reviewers. So maybe I'll share some of that info with OHA to see if we can support that process on the behavioral health side a bit better in the future.
And I did go off script on that, which I sort of feel bad about, but also I feel good about it because I did use the template as like my guidance, and I think it looks really nice the way it turned out. So as much as I did use the template, I didn't fully just make it look like the template, so
It's much prettier than the bare bones we put together. All right, any other staff announcements? Alrighty. Angela, do you or anyone else from your Best Care team have anything you'd like to share with the group?
Yeah, so the last time that that we had this meeting, I had shared our draft CFAA, which originally he was sent back and saying you need to do all of these edits just like all of the other counties throughout the state. We did some minor edits, very minor, because the reality is I feel like we hit all the points that they wanted us to, but obviously they thought some things were missing. So we did some minor ones, and the CFAA was approved. So the CFAA has finally, so that is completed, that is approved. That is essentially our statement of work for the next 18 months. There are still a lot of questions, not just, I mean, all of the CMHPs throughout the state are like still honestly have questions. So even though our statement of work is done, we're still really not sure kind of like how exactly it changes things from like a funding perspective. And so we're just getting questions answered sort of as we're going along. The reality is the work we're doing is not changing. It's just how much, figuring out how much money do we have to support this particular program versus this one. So I imagine that we'll continue to have CFAA questions for OHA probably for the first 6 months of this year before it's really kind of like, okay, we get it all. And then before we know it, it'll be time for them to do something different and there will be a new CFAA and will it be the same process or will it be something different? Who knows? But that is at least finished. So that's not something we have to worry about anymore. The other kind of big news, we did talk about this at the county commissioner work session, the last work session. We are still in contract negotiations with Pacific Source. So for those of you who do not know, Pacific Source is our CCO for this region. And we are not the only county who is still in negotiations with them. For people who do not know, Pacific Source, along with every other CCO throughout the state, except I believe 2, have been significantly in the red for a very long time. One of the other CCOs is actually $200 million in the red. And so there have been substantial changes at pretty much almost every CCO throughout the state. Pacific Source is no different. You probably did read something in the papers about 300 to 400 Pacific Source employees were laid off. Pretty much every single person who is contracted with Pacific Source is experiencing rate cuts. The initial proposed new contract with Pacific Source is no different for us. They are proposing pretty significant rate cuts. And so our CEO countered. Pacific Source came back with an automatic, like, nope, not doing it. So he came up with another proposal that was submitted, I think, about 2.5 weeks ago now, and we've not heard yet. So he and Melissa Thompson, who's our Chief Behavioral Health Officer, who's actually going to succeed Rick when he retires. She'll be our new CEO. They have a meeting with Pacific Source later in this week. So I do hope that will tell us what our new contract will look like, or maybe that's still just going to be negotiations, who knows, but it is pretty substantial rate cuts, which has led us to then go back to Pacific Source to say, okay, well, if you're not going to pay us for the work we're doing, like what programs are we cutting? Because the CFAA doesn't cover this. So it's kind of like a little dance that's happening right now. I don't get to be a part of the dance. I just get to hear about the dance. And so hopefully there will be some answers at the end of the week. But regardless of what ends up happening with the contracts, I think it is safe to say that we will experience cuts, and what that will look like as far as programs, I don't know yet, because we need to take a look at what that would look like, and then have to sit down with finance to determine, are there some programs that need to be cut? Hopefully no staff will need to be cut. I mean, that's my wish. So we'll cross that bridge once we know more. I think their meeting is on the 5th. But as I said, it's every agency has been impacted by these cuts. I mean, I know that folks in private practice have experienced it. I know that the other agencies that hold COAs with the state have been impacted by it. I think most people don't even get the chance to negotiate. They've just been told this is what it is. Being the CMHP does allow us to have a little bit of negotiating room, since there are things that the CCO expects us to do because it is in their contract with OHA. So it does give us a little bit of negotiating room, but we will see how that pans out. But that's been an ongoing thing now for an entire month. So hopefully, well, at the next meeting, I'm sure I will tell you what the deal is. The only other update on our end, and if you guys have any questions about any of this, I'm happy to answer it. The only other update on our end is we did submit our preliminary application to become a CCBHC, which is, I'm going to get it wrong. I think it's something like Clinically Certified Behavioral Health Center or something like that. I always get the first C wrong. I think it's clinically, but it might be something different. And the CCBHC funding is, it's pretty much, it's guaranteed funding. And what we are hoping, our CEO and Chief Behavioral Health Officer are pretty confident that we will likely be approved. They're going to be, I think there's funding for 9 new CCBHCs throughout the state. And essentially what it means, and we're already kind of doing a lot of this anyway, is that you can provide sort of whole health services under one roof, and or have really high level like coordination with, as we are behavioral health, high coordination levels with primary care if we don't actually provide primary care on site. And we're not going to be providing primary care on site. So one of the benefits to becoming a CCBHC is that there would be additional funding that would be guaranteed. And so the idea is that whatever ends up getting cut from Pacific Source, if we become a CCBHC, we could probably potentially just make that up. However, that whole process is it'll take the rest of this year for all of those pieces to kind of line up. And obviously there is no guarantee that we would get approval anyway. But our leaders are pretty confident that we will. And so if we do get cuts, there might be this additional stuff, but it won't be for about a year. So those are the big updates on our end.
Angela, the Best Care that serves as the CMHP in Jefferson County, they're certified, right? They're a CCBHC.
Yeah, so they became a CCBHC like many years ago, I think 5 or 6 years ago, when the original sort of pilot, I think, was like coming out across the United States. And so their initial grant funding that was through SAMHSA, I think is what it was, has run out. That was like a 5-year grant. So they are now in the process of re-upping with OHA. And so, because they already have been one and still are operating as one, I'm sure that they are going to be able to get that funding.
Yeah. Well, I think that's one of the things that helps us as we go through the application process in Prineville is Best Care is an organization that's familiar with that process.
Yes.
Rick is very plugged into that, so we'll
Yes.
send good vibes and look forward to an update, Angela.
Yeah, thanks. And it also means that we already have a lot of policies and procedures written that I don't have to write. So that's really nice.
Yes, please. All right. Thank you for that update, Angela. Are there any questions?
I know I'm throwing out a lot of acronyms and too. So if anyone has any questions about any of those acronyms or anything I've shared, I'm happy to answer them if I know the answer.
We'll write them out in the notes. Devin, go ahead.
Yeah, can you guys see me? I feel like my
You're
camera
good.
is not.
Yep.
Yeah.
Okay. Oh, cool. Okay, great. This is not exactly a question, but just as you get that information, if you'll keep us posted, because as you know, as NAMI, as our nonprofit, there may be ways that in the interim between Pacific Source Cuts and acronym
PCHD.
fill-in. Thank you. That we could potentially partner to help fill some gaps if needed. So just want to talk
Okay,
about that.
great. Thank you.
Great. Yeah, I think that is one of the benefits of this space is as services ebb and flow across the community, we can kind of say, oh, well, this is something that we can help pick up some slack, or maybe we have conversations with an outside entity that might be a good fit for the county, and we can brainstorm in this space to make sure that our residents are as impacted in the least amount as possible, as we are very much going into a season of less funding.
Across the board for sure.
Yeah.
I do have one more update. I can't believe that I didn't think of this one. It's not particularly it's not just a Prineville thing, but it is a pretty big Best Care update. So at the end of this month, I need to give a little bit of backstory so nobody goes, oh shit. We have had 2 detox locations in Redmond for a very long time. So one operating a very small detox attached to our Redmond residential program, and then another detox that was attached to our respite program. When we closed our respite program last year, because we were not being paid for it, so it was not financially sustainable, the decision was made that whole building would be renovated to become one big detox. And so we would be able to go from essentially 12 beds to I think 18 or 20 beds, something like that. And so the renovations have started in that building that had been detox and respite combined. And when we did that, we downsized, and then we're only having, because that building was being renovated, we only had the 6-bed detox at our Redmond residential program. That has not been able to financially sustain itself. And so at the end of this month, our detox is going to be closing, and we are still doing construction in the new space, but the construction well, it's not really new space because we have the space. But the construction to make the expanded detox is not expected to be done until November of this year. So we will not have detox services in Redmond. Our leaders have reached out to, I can't remember the name of the detox place in Bend, but we'll be coordinating with them as much as possible. We'll get people down to our Klamath detox if need be. Anybody who might be appropriate for ambulatory detox, we'll be linking them up with our addiction medicine clinic. Ambulatory detox just means somebody not needing to be in a medical setting who is able to take medication and go home and take medication like under a doctor's kind of orders. So our detox line will still remain open so that people can call and we can coordinate services with them. But at the end of this month, our detoxes in Redmond will be no longer until the new building opens up. much, much later in the year. So that's a pretty big, that's a pretty big cut to services in this area for sure. And it's really unfortunate. So if you had not heard that news, I'm sorry, I'm the bearer of the bad news.
Angela, you mentioned that, so the 6 beds that we had that were attached to, was it residential?
Yes.
Residential. Is the reason it wasn't sustainable because it was associated with residential, or is when we open up the bigger building, is that going to be a challenge to be sustainable as well?
So, I don't, because it's not my program, I don't understand like all of the specifics, but as you can imagine, the most expensive employees work in detox, right? Because that's doctors and nurses. And when you have a very small amount of folks that you're serving, my understanding is that the money that was coming in was not able to be, it wasn't paying for itself. So I don't think it has anything to do with like the combo of like being attached to residential, and more so that it's expensive personnel and not enough money coming in.
Thank you. Kimberly, did you have something?
I think that was my question, was if the 6-bed isn't sustainable, how can we sustain the new project? So I just didn't know what that looked like, but yeah, thank you.
Yeah, well, and it sounds like one of the other thoughts too is it has kind of never made sense that we had 2 detoxes at 2 different locations, because we had to have the same amount of like nurses and doctors and all of that at each site. Like, and so by having it all in one site, now, like when we eventually move in that direction, it won't have to be like 2 doctors. It can be 1 doctor, and however many nurses you're supposed to have, like it'll be able to be more streamlined and have it all in one location. Oh, sorry, I'm in a room with a the motion light. I'm not sure where it is.
Need a flag or something.
Yeah, I don't know where it is. This isn't working. So,
We can still see you.
okay. So, I mean, in the long run, it sounds like it's going to be a smarter like business model. It's just in the interim, it's going to be a pretty big hit to this, to the Central Oregon area. We will still have our detox in Klamath Falls though, and we do take people down there. I mean, our recovery mentors will drive folks down there when our detoxes here have been full. So we'll continue to utilize that as much as possible, but and then like I said, the ambulatory detox if somebody's appropriate for that. But yeah, it's pretty upsetting, because it's also a bunch of really great staff that we're going to be losing, while we're working on getting this other one up and running. So
yeah. All right. Any other questions? Angela? Okay. Mike, you didn't have any updates earlier. Do you have anything you want to share with the group?
Not specifically, except I'd kind of like to point out that that even though Angela is my boss,
I might be his boss, but he knows everything about his program, and I know like that much. So Mike is amazing.
Well, thanks. But the Intellectual and Developmental Disabilities Program contracts through the Office of DD Services and then up through ODHS and not OHA. So we're not affected by the CCO negotiations, and you never know what's going to happen to the state budget, but otherwise we're not facing those challenges right now.
Thanks, Mike. That's a good clarification. Alrighty. we're gonna shift gears a little bit. I want to talk about uh, Check is in the middle of a work planning process for the next 3 years. So our current work plan is sunsetting and we're moving into a new one. It's not necessarily that we just get rid of the old one. There might be things that are still applicable that we want to roll into our next 3 years of work. But we have begun that process. We had a working group. Is that 2 Mondays ago? 2 weeks
It was
ago?
2 Fridays ago.
2 Fridays ago. And we will have another one of those working groups on March 2nd, so a month from today. And the working groups are open to the public. There is encouraged public dialogue. We have partners that came in the last meeting, the first session that we had. That was really helpful because we're trying to gather as much input and insight as possible in this process. We, in our first session, did work around a visioning, developing a shared vision for what we want for our community. And then we did some problem identification work that we are synthesizing and we'll be bringing back to that work session on March 2nd. And then we will move into what can we as Check do? Where are points of influence on these issues that we've identified? What can our role be and what's realistic? So March 2nd, we'll be having a discussion about translating that need conversation into some actionable, at least buckets of work for us going into the next 3 years. So if you are interested and able to participate in that conversation, or if you know of other people who could be good to have as part of that conversation, we did some brainstorming in the last work session of who else do we need to talk to, who hasn't had to say, who do we need to really engage. A lot of that was around our end users, our folks who are using these services, making sure that we have good voice there and input there. So we'll do some recruitment work to, whether they can make it to a work session or not, we'll do some phone calls, we'll do some work to get that information from folks. But as I was saying, if you know folks who it would be good for them to be part of that conversation on March 2nd. It's a public meeting, and so it's posted on the county website. If it's not now, it will be soon. And there will be some promotion going out through listservs and things about that meeting that you can feel free to share out when that gets sent. But so that's our next phase, is that second work group meeting. And then once we have a draft, we've been talking about having a retreat for appointed members to go through, because not all appointed members are able to come to the work sessions, and there will need to be some finalizing work that gets done before we bring it back to, I believe, our June regular meeting for adoption. So we are looking at, I think it's May to do either a retreat or an extended meeting that we'll have to work really hard to make sure as many appointed members can get to that as possible, so that we can have that 3-year work plan fleshed out enough that we feel like we can adopt in our next regular meeting without a whole bunch of a discussion, because we're gonna have several other agenda items in our June meetings. So as much work as we can get done in these work sessions between now and then, the better. I'm wondering if there are any questions about that process, questions or suggestions. or if there's anybody who was at that first work session, if you have something that I've missed that you think might be worth sharing out. I welcome other brains. Like,
It went well. We got a lot of information.
That was good.
one of the things that we did is we went through other community assessments and plans because there are several. Multiple organizations are required to do assessment and community engagement and planning processes. And so I don't think it's necessary that we do a whole lot of that assessment and research piece as a check group, because there's so much of that information that exists for our community already. If we do find gaps in that assessment or the assessment work that's already been done, we can absolutely do some of that work. We have great staff support here at the health department. But I also think that there's so much information out there that really does affirm that there's, when we talk about needs that are identified in the community, there's several that come up in each one of these plans, whether it's St. Charles or public health or
Central Oregon Health Council.
Central Oregon Health Council. There's several that there's consistency across. It's not like every single one of them is different. Great. So we'll continue that discussion. March 2nd, please put a hold on your calendars if you don't have it already. We would love you to be there and then share that out with others.
And I will note that I made that meeting on the same cadence as our regular meetings. It's just an additional month. The January one, I couldn't do that way, but
Yeah,
I
that'll be
tried-
only Friday meetings that we have for this.
I tried to make this one as similar to the rest as possible.
All right, so that being said, we already have a work plan. We have a 3-year work plan. And we are coming up to a point where that's going to be sunsetting, and then we'll go on to the new one. So if there is something that you really want us to focus on in the next, well, until the end of June, I was hoping we could identify that and make some action items. And so in our current work plan, we have priority areas around staffing and supporting staff in all of our health spaces, behavioral health, physical health, social services. Is how do we make sure that our staff are supported, that we're reducing turnover, that our staff have childcare, that there's all these things that we're very mindful of as we're talking about. I know we continue to have conversations about recruitment and recruitment challenges that we have in Kirk County specifically. And so that's a bucket of work that if there is something that we can be doing in the next 4 months, let's do that. And again, I'm not saying that won't be a priority area going into our next work plan, but we just don't know that yet. The other body of work that we have in this current work plan is around health system coordination. And that's something that I know there has been work happening among organizations that, and maybe you all can give an example of this, but Best Care and Mosaic or Best Care and St. Charles are having these very regular coordination meetings. I think the juvenile department is in on some of those, so that we can support the transition of folks between primary care and behavioral health, or vice versa, our emergency system and behavioral health and vice versa. But if there's anything that we can do to support that care coordination piece in the next few months, that we can pick some action items from there. And then the other one that we've been doing on an ongoing basis is making sure that this advisory group, the appointed members, are aware of services that are required to be offered in Kirk County, and that we're supporting that work. And I think having Angela and her team present out of, here's where we're at with our planning processes, here's a description of from Oregon Health Authority of the services that we have to offer, this is what we can do, what we can't do, how prioritizations are set, appointment availability, all those kinds of things. That information being shared out in this group, I think, has gone a long ways in accountability for the programs that are offered, and also identifying ways that we can support the success of those services and programs. I also think that Angela and team presenting directly to the commissioners in work sessions has been good. That's monthly, correct, Angela? Yeah, so I think that's gone a long ways to create connections and awareness of services that are offered specifically by our CMHP. And also as CHAC as a large group, I think we're about due for a commissioner presentation. CHAC doesn't necessarily have monthly touch points with the Board of Commissioners. In our bylaws, we do have an annual touch point that is required. And so that will likely be something that we'll need to be working on over the next few months, is what information do we know we need to get in front of the Board of Commissioners, and what can we be updating them on, as far as our body of work over the past year as well. So I'm going to put that one on the list. We know we got to do that one, but is there another one of those buckets around staff support and then health system coordination that you think we could prioritize over the next few months, or that it would be best to prioritize?
Is there a health system that has mentioned that they don't feel included in some of those meetings?
They haven't mentioned it to me.
Okay, I'm just curious.
Yeah, I think it was so originally 3.5 years ago when we put this last work plan together. It was something that we saw a model that was working, and it has expanded out since then. But I don't know if and Angela, maybe you can speak to this, or if there's another provider who it's like, oh, that would be really good for us to have that added regular touch point. So that, and again, the original goal of this was to make sure that referrals back and forth between behavioral health providers and physical health, for lack of a better.
Primary care.
Primary care, thank you.
Yeah.
Primary care and emergency medical services. And so if we feel like that is operating well, and maybe Angela, you can speak to that because you're kind of you're a linchpin to that. Maybe we don't need to do additional work there. We just need to either, if we can help foster sustainability of what is currently happening, or do a gap analysis to see if there are providers who are needing that extra coordination support.
Yeah, so we actually have a meeting. When is the meeting? It's
In a
this
few
month. I know
weeks.
that. I don't
Yeah,
know when it
sometime in
is, but it's this
February.
month sometime. With Pacific, or not Pacific Source, with Mosaic, St. Charles, and us to talk about workflows and referrals and all of that kind of stuff. So I mean that's still happening, but it's, it sounds like the leaders are gonna convene and kind of talk about, I think, what's working well and where are some areas for improvement. I don't know if that's necessarily something that needs to be like on a plan for this group. If we're kind of making efforts on our own, kind of like outside of the group, to address the issues. But so I don't know if that means, there might be that, like, is our time better spent in this group doing something else?
Just like I'm putting missing from that group. We mentioned Mosaic, St. Charles, Best Care. what else are we missing? Do we have connections with Rimrock? Do we need to have connections with Rimrock?
Mm.
Does the health department need to be involved, or are you feeling like our coordination is going well? Like, that's what I mean, like.
Yeah.
Are we missing someone, or do we feel like all players are at the table and we're doing good?
Yeah, a lot of this energy has been focused on primary care and emergency provider relationships, very specifically with Best Care. And there are other behavioral health providers that I don't necessarily have a sense of how that care coordination is going or efforts that are happening there, but maybe that could be something that.
And I think I remember from a previous meeting, Hope mentioned something. And I think, Angeline, correct me if I'm wrong, but I think Hope said she communicates with you guys pretty well when she shares patients with you guys, but I don't think she has as good of connections with other, like primary care or other places where her patients are going. So I don't know if it's maybe just bringing in more private behavioral health and mental health providers into some of those meetings. I don't know. I can't speak for Hope. I just remember her mentioning that previously.
Always giving an option.
Yeah, exactly.
That might be a conversation with our primary care and emergency partners to see what other behavioral health touch points they have that we might be able to facilitate in coordination with. Great. Anything else that's floating to the top for folks that we can rally behind?
I do think Rimrock has a new program, and I can't remember what it's called, but it's kind of like a walk-in behavioral health at their new outpatient clinic. Has anybody heard of that? I can't think of what the acronym is for it.
Is it the ARC program, Shelby?
Yes.
Yeah.
Do you
I
know
think
what
it's
ARC
like,
stands for?
I want to say it's like assessment. Oof.
Access
Oh, yeah.
resource, access resource
Yes.
Center?
something.
Okay.
Center.
Center C's with AMC.
We can work on
All our minds
it.
together.
I can text my mom.
I just met with Daniel though, who they just brought on board to lead that program. And he's very new. He just started, I think, about 3 weeks ago. But yeah, I learned a little bit more about their program with him if you have any questions.
If folks are interested, that could be something that we can invite guest presenters to our track meetings. So if there's another program that you all want to know more about, we could work on getting that scheduled over the next couple of months too.
I think the nice thing would be, I think they have like the funding for it to run right now, so if we can just direct more people there.
Yeah, I
Let's
met with
say- Okay.
Daniel there last week as well. Sounds like the program is very new. It's kind of in its infancy. But it sounds like, again, like Haley said, that they have some promising funding for it and plans are moving forward. We are partnering with them to start a family support group at their outpatient location in Prineville here in the next couple of weeks. So that's something that is coming up. But
Oh, what group, Devin? Sorry.
sorry, a family support group.
Thank you.
And Haley noted that they have room for referrals and specifically youth, Haley.
Yeah, I think their program is for kids like 10 to 17, I want to say. But he says they have total capacity to take on more folks if there's folks that need that support.
There's also some additional behavioral health support. Oh gosh, Kids Clinic has a psych NP that is available, so that's another good resource for our kiddos. Okay, so we're taking notes. Well, Alex is taking notes.
Not well.
For some future planning for next couple of meetings. One other thing that has come up is OHSU would like to engage our group. Alex, do you want to share a little bit more about what that might look like?
I honestly don't remember everything. It's been like 4 months since she initially asked, but if any of you know Caitlin Green from OHSU, her and another gal on her team, one of their things over the next few years that they're supposed to focus on from their work plan is this cancer talk. And they're really focusing on trying to get the community to know what can affect cancer and foods and different types of things. And I think they also want to know resource availability in the area and things like that. So they reached out to me asking if they could give a presentation to the chat group. It would likely be 90 minutes, so it would take most of one of our meetings. So I told them that we would check with everyone first if that's something that everyone thinks is worth our time, or not.
Looks like we'd be looking at the April.
Yeah, it would probably be in April. So our next regularly scheduled meeting.
I'm scrolling through some
Emails.
the back and forth.
I don't have like
I mean, I know I'm not a member, but I think that sounds really interesting, and I think just having OHSU interested in what we're doing here is awesome.
It's working, so it's not just like an hour and a half presentation at us. It would be an engaged conversation
Yes.
about what we think might be feasible for them to do in this space. So they're definitely wanting to get our input in how to engage Kirk County in a meaningful way around the cancer outreach. I don't know if it's connected to their prevention efforts. I think it's basically all things having to do with the Night Cancer Institute and how they're engaging our community. So I think that since we have our working sessions, that as long as we're able to be really productive in those spaces, I think it's likely possible for us to be able to dedicate that much time in an April meeting to have that conversation, but we wanted to pose it to you all first.
Okay.
anyone online have any interest or not interest?
I think it should happen, and it's a great conversation, and I would love to be a part of it. It worries me a little bit that we will fall behind on our agenda to take a whole CHAC meeting to do it, because that pushes us to not meeting again really until June. But I could be convinced otherwise if anyone has thoughts on that.
Wait till like July or whenever to do it, or do they need to do it now?
I can ask her, but I think they're trying to get all of these talks and presentations done within a certain amount of time so that everyone around the state can bring it all together and then they can figure out what direction they're going to go. I know they've already done 2 in Crook County that are for like the public, for just people who have, I think the last one she said was for people who have cancer or know someone who's had cancer, so they wanted to get their input, but they also need to get provider input. And so she was hoping to come to this area where there's people from all of the providing areas of Crook County.
We're trying not to create another meeting.
Maybe they can like shorten it a little bit. Like
That is their shorter one.
oh
Yes, I tried. Yeah, I tried.
Well, I think what we can do is make sure that that it isn't something that would put us behind in our planning process, and then our regularly scheduled agenda items on top of that. And if we can make that happen, we'll go ahead and move forward with scheduling to have them come in to present and not just present, engage with us. Okay, sounds good. Courtney has a question in the chat about if there's potential for a comprehensive resource of mental health services and support groups. in the county because it would definitely be helpful for Courtney, it sounds like, and for folks that are being treated in physical rehab. That's for Courtney.
I responded as Shelby in the chat, Courtney, but I have one of those that I've made for the health department that we give out at events and stuff and share with partners. So I'll email you a copy, and if anybody else wants one, please just let me know and I can email it to them as well. I try to keep it updated every few months. Sometimes things change before I figure it out, but
Okay, we'll get one to you too.
yes, Devin.
Oops. Okay, we cruised. I told you I didn't think we'd use our full 2 hours. So our next regular meeting is April 7th. Our next work session, work group on strategic planning is March 2nd. So unless there is anything else for the good of the group, we will wind down our time together and you can get a lunch hour, hopefully. I'm not seeing anything in the chat. All right. Well, for our folks online, thank you for joining us very, very much. Folks in the room, thank you. Please take food for your now lunch hour.
Please.
If any of you that are online would like to swing by and grab
Please come.
please do. Otherwise, we will see you all in either March or April or before then if we cross paths, which is also likely. Happy February. Take care, everyone.